So I'm going to start off by just wiping her knee off with this alcohol wipe, just in case she's wearing any lotion or anything that's going to decrease the stick of the tape. Not a requirement, but just in case she has something that's going to make it not stick as well. So this works well for someone who has any joint line pain. It's very easy for a patient to be able to do themselves, so I use it quite a bit. I've got 3 strips of tape that are each about 8 to 10 inches long with the corners rounded so it doesn't catch on her clothes. If someone has pain that's more laterally, I'm going to put 2 of the strips on that lateral aspect of the knee, versus if someone has medial knee pain, I'm going to put 2 of the strips medially. So you see I'm going to do 1 lateral, 1 medial, and then I'm going to finish with another 1 lateral because the pain for her is more on the outside of the knee. So I'm going to tear back a little corner of the tape, and I'm going to start off laying this down across the lower aspect of her calf, rubbing it to make sure it sticks, and then I'm going to flip back this piece of paper here so I have this little tab and I don't need to touch the adhesive of the tape. Now, as I come across, I'm not applying any stretch yet, and then once I get beyond that midpoint of her knee down below her patella, I'm going to start to apply maybe 50 to 60% stretch. So instead of stretching the life out of this, just a very light stretch in this up and in direction as I come up around the side of her knee. And then once I get to here, I'll stop stretching, and then I'll once again just lay the tape on. So we never stretch the tape on the ends, just in the middle. Now, next piece, I once again tear a little tab off, and I'm going to start on the outside, just laying this on the outside of her lower leg or shin, peeling back the paper so I have this tab to hold on to. No stretch coming across. When I get to about that same midpoint, I'm going to give her that same tension, a little bit, 50 to 60% up and in, as I get about just past her patella, and then I lay the tape on again to form this little X. Now that alone is a pretty good supportive taping for anybody who has pain underneath their kneecap or along the joint line. But then just for safeguarding, she has some overuse of her IT band, so I'm going to swing this last piece up and around and across to try and decrease the pull of that IT band at the outside of her knee. So I'll start this one a little bit more in the front of the shin. Once again, I'll peel back some paper on the tape, laying it on the skin here to start. And then once I get towards the outside of the knee here, I'm going to apply a little bit of a stretch up and in, trying to make sure I don't get too many wrinkles in the tape. Coming across, and then once I get up to the top of her knee, trying to make sure this doesn't wrinkle off her skin here on the outside. There we go. And then coming up and across and laying the tape down. And you'll see this may want to start to wrinkle a little bit, so I want to make sure that I give a good rub over top at the edge of this tape so it doesn't pull off the skin. And I want to try and get a good rub across each portion of the tape to make sure that it sticks, because heat activates the adhesive of the tape to get it to hold on to her skin. And I did this whole taping with her knee just slightly bent, a small pillow or wedge underneath it. And that's it.